I would add something also that differentiates Elucid from the others in the market, in my opinion, and that is the flexibility of Elucid and the ease of its use. I think the use of histologically validated plaque characterization AI techniques makes for an easier situation for the clinician, where you don't have to necessarily generally model the entire coronary tree to specifically look at one particular area of the coronary anatomy, one segment, et cetera. And I think that ability to do that on site, in other words, to take that technology and bring it to the physician at the point of care, I think is a tremendous differentiator. But also with the ability to do it in a more generalized fashion by Elucid themselves as well. So it's a more flexible technology, in my opinion.
Got it. Leslie,
I was just going to make a quick comment, is that, what Andrew just talked about is more fundamental than we could have spend time on here today, is AI-based plaque segmentation. If it's not done properly, can be highly misleading. These are small structures. There's a surrounding coronary fat that has differential densities. Could be very misleading to the risk in that population. And I personally, as an expert, I've seen the other platforms. The clinician has to be understanding of AI can be misleading, and we need the AI to be as accurate as possible and to be fundamental to what's going on in the disease burden. And if it's not, it's just going to be a kind of a prediction, which is kind of correct. And I don't know if it's your patient or your family member, I don't want it to just be kind of correct. And we have we have experts here, but many folks reading scans are not experts. And if they don't know any better, they're not going to get a good diagnosis. And that's where things fall apart for the patient, is when we don't bring best tools to the bedside and to taking care of the patient. So the AI and the modeling techniques are fundamental to development of this field. And the more they're scientifically based, the better off we all are.